Casey is a 24-year-old woman presenting to the emergency room with nuchal rigidity. Nuchal referring to neck, rigidity meaning stiffness. The back of her neck was stiff. She was wearing sunglasses, and when doctors took them off of her face, she vomited all over the floor because she was so sensitive to light. This photophobia, phobia meaning aversion to photo, Greek for light, combined with nuchal rigidity means something horrible is happening near her brain. 5 days earlier, Casey tried to put on a shirt. Suddenly, her right thumb shot a sharp pain through to her elbow. At first, she thought maybe she just moved funny. She tried to shake it off, but the hurt wouldn't go away, and then her left knee started throbbing. It was getting hard for her to walk. She got a sore throat, and then she couldn't bear to see any light. While telling doctors this, she started getting confused. Her words seemed nonsensical. She kept repeating the words boyfriend, clap, and cheeks. Older medical staff glazed right over this, noting that her thinking was tangential, but the younger resident immediately raised an eyebrow. He tried asking her for more information, but he couldn't get a coherent response. Casey has a fever. Her blood pressure and her heart rate are high. A blood test finds she has leukocytosis. Osis meaning disorder, cyto meaning cell, and leuko meaning white. White blood cell disorder. In this case, she has many more white blood cells than normal. Fever, stiff neck, photophobia. It looks like an infection is happening in her nervous system. Doctors can quickly confirm. The brain and the spinal cord are surrounded by a liquid that cushions and protects it called cerebrospinal fluid, CSF. A needle pierces into her back. CSF flowed out. Doctors collect it, and it's here where they see that it was yellow, hazy, and cloudy. It's not supposed to look like that. In the lab, Casey's CSF was found to have protein and low sugar floating around. These aren't supposed to be in here. Metabolism creates wastes, uses proteins and sugars. Whatever's in her CSF is eating, sleeping, reproducing, and making waste. This strongly suggests bacterial meningitis. Itis meaning inflammation of the meninges, a thin layer that covers and protects the brain and the spinal cord. But there's a problem. The point of the meninges is to provide a barrier for the brain from the rest of the body. When it gets inflamed, it's still protecting the brain, so people with meningitis are still lucid. They don't have brain problems, but Casey's confused. She can't speak properly. She can't tell where she is. She's mumbling some boyfriend somewhere is clapping some cheeks, whatever that means, meaning that she has brain problems. This isn't a normal infection. It's gotten through to her brain. This is meningoencephalitis. Hey, quick question. If you're learning something from this video and you're not subscribed yet, I'd really appreciate it if you did subscribe and come back to see the video that I post next month too. I make on average one video a month every month since 2017, and I try my best to make each one worth your time. No AI, it's just me and a couple of colleagues to check, because I do actually like making videos, and I hope you learn from and enjoy them too. Appreciate you. Meningoencephalitis differs from meningitis in the fact that the brain is inflamed with the meninges. Encephal refers to the brain. For some reason, Casey's meninges couldn't protect her brain from the rest of her body. Whatever is causing the infection has gotten through. It's spilled into her brain. But even worse, 60% of the time, the causative agent of meningoencephalitis can't be identified. CSF is easy to collect, but if testing it doesn't return anything positive, there isn't an easy way to collect part of the brain to test, meaning that doctors could be operating completely in the dark. When Casey's CSF was put in a petri dish, no bacteria grew. Viral DNA was tested for, nothing was found. These tests take days. If she has a worsening infection, you don't have days to wait, because whatever's in her brain and her meninges are growing and multiplying. Just because the known tests didn't return anything might only mean that her infection is something unknown. Luckily, doctors could still do something. Casey was started on 2 antibiotics, an antiviral medicine and a steroid to limit inflammation. Based on everything that doctors know, at least one of these should at least hold the infection at bay. If the tests aren't returning anything positive, it doesn't mean that there aren't any bacteria or viruses in her nervous system. Rather, it could mean that they aren't looking for the right ones. They can discontinue all other antimicrobial medicines when they figure out what's infecting her. But with everything testing negative, it looks like they're at a dead end, except someone wanted to try something. A few weeks earlier, JW, a 66-year-old woman, presented to the emergency room with stiffness, swelling, and a pain in her right thumb and both ankles. 10 days earlier, she was feeling fine until suddenly, when she was baking cookies for her grandkids, her hands felt like they were on fire. It was a pain that radiated up from her thumbs to her elbows. At first, she thought she could shake it off. Maybe the hurt was just in her mind. But as the days went on, the pain only got worse. When she went to see a doctor about this, x-rays were totally normal. Nothing looked wrong. She tried to convince herself everything was fine, but nothing was fine. 4 days later, which is 6 days before she presented to the emergency room, the same feeling, burning, in her thumb started pulsating into her ankles. The hurt would shoot up towards her knees. Her primary care doctor thought that this was arthritis, inflammation of the joints. Steroids were given to her. These blunt the immune system, limit inflammation, and should reduce some of the pain that she's experiencing. But they didn't work. And when she went to this hospital, this resident took care of her, but in the process, he found out something horrible. Arthritis in a 66-year-old woman isn't out of the ordinary, but JW's joint pain was sudden onset, rapidly progressive, and completely refractory to treatment. This isn't normal. Regular arthritis isn't this quick, it isn't this severe. Something changed in her body in those few days. Something that happens this quickly is infection. Virus and bacteria can get into the joints, causing swelling, causing pain. But what infection? The resident ordered tests. Hepatitis is a virus that damages the liver, but it can cause arthritis. Negative. Lyme disease is an infection from a spiral-shaped bacteria named Borrelia burgdorferi, transmitted by tick bite that can also do it too. Also negative. All other known bacteria, negative. Except, at the bottom of his list was one final bacteria. There were 2 reasons why he didn't order tests for it. First, this kind of infection transmits human to human by physical contact. It's not severe when treated early. It almost never spreads throughout the body, but it can infect the joints when it does. Second, from a social convention standpoint, the resident felt awkward asking about this particular infection because the physical contact required for this infection can be daunting for a young medical trainee to inquire about in a 66-year-old grandmother with an established social history of being in a thought-to-be monogamous marriage. This bacteria is the one responsible for gonorrhea. Gonorrhea is from intimate human contact involving the bacteria Neisseria gonorrhoeae. Typically, infection and most of its symptoms are at the site of contact. There's a few different sites, but sometimes the infection becomes disseminated. The bacteria escapes the inoculation site and infects the person systemically. It gets into the joints and forces extreme inflammation. Steroids won't help because physically there's something growing on the bones. This is what was happening to JW. Her gonorrhea was confirmed by lab test, and recent intimate contact was discussed and confirmed. But in very rare cases, Neisseria gonorrhoeae gets into the brain and the meninges, bringing us back to case C. The resident remembered JW's case from just a few weeks earlier because KC had also described a sudden onset intense joint pain while she was still lucid. If gonorrhea is a communicable disease that's appeared in the area recently because another patient just came in with it, and KC's meningoencephalitis could be caused by it while she's tested negative for everything else but this, then is it possible that gonorrhea is in her brain? The remaining CSF was tested, different from what was already done. And it turns out Neisseria gonorrhoeae is in her brain. It's in her meninges. It's inflaming her nervous system and her joints. Gonorrhea has spread everywhere in her body. KC has gonococcal meningoencephalitis. In a brief moment of clarity, after the 4 medicines were started, KC told doctors what she meant when she said the words boyfriend and clap. 1 month earlier, KC's boyfriend had contracted chlamydia from an encounter outside of their relationship. He told KC about this because they had intimate contact after he got that infection and before he was diagnosed. And when he got diagnosed, he did the right thing and told her. KC received partner treatment with azithromycin. Sometime after receiving this antibiotic, which was around 7 to 10 days before she presented to the emergency room, KC had intimate contact with this boyfriend again, but by then, this boyfriend had contracted gonorrhea from yet another encounter outside of their relationship. This tells us how she got it and who she got it from, but it doesn't explain why KC and JW's gonorrhea spread throughout their bodies. But public health officials would learn something about this gonorrhea that they didn't know before. When doctors found Casey's disseminated gonococcal infection, they reported her case to the Michigan Disease Surveillance System. The Michigan Department of Health and Human Services took note because this was part of an ongoing problem in this region. 2 years earlier, in 2019, Kalamazoo County Health and Community Services Department was notified of 3 patients hospitalized for disseminated gonococcal infection. 2 had septic arthritis, another had gonorrhea growing in their heart. Neisseria gonorrhoeae doesn't spread further than the site of infection typically, but 3 disseminated cases happening at once in the same area means that a new strain with the ability to spread around the body is in active circulation. Kalamazoo County Health and Community Services Department and Michigan Department of Health and Human Services opened an investigation. When they looked at the reports, they found 27,000 cases of gonorrhea had been reported in Michigan in the 18 months prior. Zooming in, they found that in the 4 months prior to August 2019, 16 cases of disseminated gonococcal infection had been reported in Southwest Michigan, 14 in the same city. When they contacted these patients, they asked if any of these 16 patients had had contact with one another. They might have, but they didn't know or name each other specifically. No social connections were found among any of them, but genome sequencing of the Neisseria gonorrhoeae told another story. In the lab, they tested samples from 11 of the patients and found that the Neisseria gonorrhoeae bacteria were all identical. Just a handful of changes were observed throughout the entire bacterial genome coming from each patient. It's unclear how these patients didn't know each other, or if they did have contact with one another, they may not have been aware of the exact other individual during the contact in whatever capacity. One possibility is that several more people were infected with this strain, but they didn't get disseminated infection, or if they did get infected, maybe they didn't seek care, so it wasn't reported. Women sometimes don't show symptoms of gonococcal infection, so they don't even know if they have it if disseminated infection doesn't emerge. But what is known is that Casey and JW's case appearing 2 years after this infection cluster was described means that this particular Neisseria gonorrhoeae strain was still circulating in the area. CDC was contacted for help and more information was discovered. When gonorrhea is diagnosed, it has to be reported to public health agencies. We know 600,000 gonorrhea cases were reported in the United States in 2023. We know it's been increasing since 2009, just like other similarly transmitted infections. But public health agencies have also been tracking and documenting the new strains that keep emerging. Everything shows that Neisseria gonorrhoeae is evolving in dangerous ways. In the 1930s, scientists were researching chemicals that could serve as antibiotics. They paid close attention to a color dye that was patented in the early 1900s and found that it was able to destroy certain bacterial species, one of which was Neisseria gonorrhoeae. This medicine was called sulfanilamide, and it worked. Patients with gonorrhea successfully treated their infection with the medicine, but over a few years, doctors started noticing that the infection would persist after ever-increasing doses of sulfanilamide. Neisseria gonorrhoeae makes vitamin B9, folic acid, to produce DNA so that it can reproduce. The bacteria makes a chemical called para-aminobenzoic acid, PABA, to tell its machinery, hey, it's time to reproduce, so I need some folic acid. Sulfanilamide looks like PABA. When sulfanilamide gets into the bacteria, it screws up the machinery so that folic acid isn't made. Then DNA isn't made, and Neisseria gonorrhoeae doesn't reproduce. The problem is, Neisseria gonorrhoeae started noticing that something was getting in the way of its folic acid production. In response, it started making insane amounts of PABA to drown out sulfanilamide, rendering it useless. And then it started producing new strains who would do this by default, meaning Neisseria gonorrhoeae successfully evolved sulfanilamide antibiotic resistant. No safe amount of that medicine would ever work again to treat this infection in humans. But this was perfect timing. This happened in the 1940s and penicillin had just started to become mass-produced. If sulfanilamide doesn't work anymore for gonorrhea, that's no problem. Let's use penicillin. And this worked really well. A dose of 50,000 units was extremely effective, but as the years went on, gonorrhea patients required 200,000 units to clear the infection. 30 years later, by 1972, the known regular dose was 4.8 million units. And in 1976, something horrible was discovered. A 25-year-old man at an Air Force base in California had just returned from the Philippines. He complained of dysuria, trouble urinating, and a funny-looking painful discharge that would emerge from between his legs. Urethral smears revealed Neisseria gonorrhoeae. 4.8 million units of penicillin were administered to him, but a week later, his problems got worse. Doctors tried a different antibiotic, but it didn't work either. 2 weeks later, infection still raging, doctors tried 4.8 million units of penicillin again, and it still didn't work. Repeat urethral swabs revealed Neisseria gonorrhoeae was still there. When they finally gave him a different antibiotic of last resort, his infection was cured. But why didn't penicillin work? Gonococcal samples that were collected from this man were sent to CDC. They tried some tests. No results returned anything insightful, but scientists had an idea. Penicillin chemical has one unique structure. This is called a beta-lactam ring. This is the part that destroys bacteria. Scientists attached other chemicals to a beta-lactam ring. If bacteria does something to it, the attached chemicals will force a color change. And we can see this, and we'll know that something has happened. And when they poured this into a sample containing Neisseria gonorrhoeae, grown from this man, the color changed, meaning this man's bacteria was doing something that it had never been seen to do before. We used penicillin to treat gonorrhea from the 1940s to the 1970s. It worked, but Neisseria gonorrhoeae bacteria had been slowly learning how to resist and survive penicillin. That's why the dose needed to clear infection increased from 50,000 units to 4.8 million. But in 1976, the bacteria finally refined its evolution and gained a new ability. In the scientists' test, cleavage of the beta-lactam ring forced a color change. This told doctors that the bacteria collected from this man's gonorrhea evolved the ability to destroy penicillin in a way like never before. Specifically, it developed the ability to create an enzyme that breaks the beta-lactam ring that enables penicillin to kill bacteria, completely disabling the antibiotic. And in just a few years after this was first observed, almost all known gonorrhea cases were totally resistant to penicillin. It would never be used again. But it wasn't finished here. Another antibiotic class called a tetracycline was being used for gonorrhea since the 1950s. Slowly, as the decades passed, scientists were observing that Neisseria gonorrhoeae had evolved an ability to change its protein shapes so that it removes tetracycline, rendering it completely useless by 1986. Even worse, scientists found that the bacteria could transfer that mutated gene to strains that didn't have the gene. But it would only get worse. A class of antibiotics known as fluoroquinolones were used for gonorrhea starting in the mid-1980s. These can be pretty strong medicines with side effects sometimes not seen with other antibiotics. But not even 10 years in, the dose needed to treat gonorrhea doubled. Because our technology had advanced in the 1990s, we started observing that Neisseria gonorrhoeae is able to take DNA from its surroundings and incorporate those genes into its own genome. And by the 2000s, enough genes were picked up by all gonorrhea strains to confer resistance to fluoroquinolones. We still had options at this point. Azithromycin, the antibiotic known as Z-Pak, when one gets a cough or a sore throat. It was effective for gonococcal infections in the 1990s. But then, when the dose required to treat infection dramatically increased, scientists started noticing Neisseria gonorrhoeae had developed a mutation where it could actively spit out azithromycin from its insides so that the antibiotic couldn't contact any intracellular machinery. And Neisseria gonorrhoeae had evolved a backup plan because that cellular machinery azithromycin would have broken had been mutated to resist the antibiotic, leaving us currently with just one final antibiotic to treat gonorrhea. But these mutations are just for antibiotic resistance. Other mutations can enable the bacteria to do unimaginable things, bringing us back to KC and JW's case. CDC had been collecting and cataloging Neisseria gonorrhoeae strains for decades. When they analyzed the bacterial genomes from the 2019 Michigan disseminated gonococcal infection cluster, they found out it was descended from an earlier known strain that only caused symptoms at the site of infection. When they looked closer, they found that of all the gonorrhea strains circulating at that time, this particular strain formed two distinct groups of descendants. One group featured random mutations, nothing important, but the other had one particular gene mutation called the PORB1A gene. This created a version of a protein that sits on the outer surface of the bacteria. We wouldn't have known what that does, except all the gonorrhea collected from the 2019 Michigan disseminated gonococcal patients were from this family, meaning this mutation enables the gonorrhea to spread all over the body, causing septic arthritis in JW's case and meningitis in Casey's case. 2 years after the cluster report, this mutated gonorrhea was still circulating around in southwest Michigan, and it was what had infected both patients. Back in the hospital, one of the antibiotics that Casey was started on before doctors had figured out what her infection was, luckily, was the one that works on Neisseria gonorrhoeae. Other medicines were stopped. She was continued on this ceftriaxone. Over days, her condition started improving. Scientists have had more time to investigate this particular gonorrhea strain since the 2019 Southwest Michigan cluster. Since 2023, gonorrhea cases have decreased in the state, and good news is that it appears that this strain hasn't been in circulation since then. Recent studies have found that the particular mutation that it featured conferred a 20 times greater risk of disseminated gonococcal infection than other known strains at the time, meaning something about it caused the bacteria to break out from the infection site and float around in the body. And this is what happened to KC. The nature of the contact she had with her boyfriend after he contracted gonorrhea from an encounter outside of their relationship explains it. The oral cavity and its physical connection to the sinonasal cavity has proximity to the meninges and the brain. And coupled with the fact that the transmitted gonorrhea strain has a mutation that enables it to traverse in and out of human cells to infect all kinds of tissue, it means that Casey may have gotten the gonococcal meningitis through an unfortunate series of events. Interestingly, her boyfriend didn't appear to have a disseminated gonococcal infection despite Casey getting it, although he may have gotten treatment earlier because the symptoms do show up quicker and more commonly in men. There was one final observation that was noted in the 2019 Southwest Michigan cluster. The poor B1A allele that allowed it to break out and infect the whole body did not enable antibiotic resistance. So for now, this mutation by itself is a survival dead end. It's currently unclear if the poor B1A mutation forces the bacteria to be ceftriaxone susceptible, or if it's only a matter of time for gonorrhea to evolve ceftriaxone resistance with the enhanced ability to disseminate into the human body, creating a real multi-drug resistant super gonorrhea. But at least for now, we still have some time to find the next antibiotic for Neisseria gonorrhoeae strains that will emerge in the future. After the right antibiotic treatment, discovered by a diligent resident who paid attention to recent cases that he had seen, KC was able to make a full recovery. Thanks so much for watching. Take care of yourself and be well.